Okay, so the first thing I'm going to do is perform a working knowledge of the medication. Now I'm going to verify my doctor's orders to my MAR. So I have my patient's name, Jane Tripp, medical record number 567-324009, 567-324009, date of birth 10/31/XXXX, and date of birth 10/31/XXXX. Here I see that the patient has an allergy to penicillin, so I need to record that on my MAR, that she's an allergy to penicillin. I'm going to be giving her heparin today, so I'm going to be comparing my heparin. So I have heparin and heparin, 5,000 units, 5,000 units, subcutaneous, every 12 hours, and Q 12 hours. Now that I've verified my orders, I'm going to date my MAR, 11/13/20. And I'm going to, now I've completed I can put my medical orders away. Now I'm going to perform a hand hygiene. And I'm going to gather my supplies. I'm going to need a label. I'm going to need a 1 milliliter insulin syringe. And I'm going to need 2 alcohol pads and a medical tray. So now I can get out my medication. And I have heparin. I'm comparing it, so I have heparin and heparin, 5,000 units per ml, 5,000 units. So I'm going to need 1 ml. The expiration is December 1st, 2021, so I'm good to use it. Going to set it on my MAR. Now I'm going to prep the bottle. Throw this in the trash. I'm thoroughly cleaning since it was an already opened bottle. And I can throw that in the trash. Now I'm going to open up my needle. And draw back to 1 ml. I'm going to uncap my needle, go straight into the middle, inject the air, invert, make sure my needle is below the medication line. I'm going to draw back, making sure I don't have any air bubbles. Okay. I'm going to I'm going to recap my needle using the scoop technique. Maybe I'm not. Okay. Now it's been properly seated. I'm going to make a label for my injection. Label it. Label how many units. Now I'm going to get it verified by another nurse that I have the correct amount of heparin, so I'm going to show it to my nurse. that I have 100 units drawn up, that I have 5,000 units of heparin, 5,000 units of heparin per 1 ml.
Yes, that all matches.
Okay. Now I'm going to draw back 0.1 mLs of air and place it in my medication dish. I'm going to place my medication in my medication dish. And now I am ready to go. Sorry, now I can sign my paperwork. Student nurse, initial, and the time is 21:29, and I will initial and cite after I give it. So now I'm going to head to my patient's room. Good morning, my name is Laurel. I'm a student nurse with Palomar College, and I'm going to be here giving you your heparin today. Can I go ahead and verify your armband, please? Can you tell me your name and date of birth?
My name is Jane Tripp, and my date of birth is 10/31/XXXX.
Perfect, and I'm just going to verify your medical record number, 567-324009. Okay, so this morning I'm going to be giving you your heparin injection. You're going to be getting 5,000 units this morning. Okay, so I'm going to go ahead and clean the site that I'm going to be injecting. This might be a little bit cool. I'm thoroughly cleaning the area. I've selected the side of the abdomen, avoiding the umbilicus. I'm going to be using my swab to show me where I have cleaned. Take off the cap. I'm going to make a big C and dart. Let go. Inject. Hold for 10 seconds. And pull. This is going to go directly into my sharps container. And this is going to go into the trash. Okay, that's all. Is there anything else I can get for you this morning before I go?
No, thank you.
Great. And now I'm going to take my gloves off. This card goes into the trash. And leave the patient in a safe position with their call light in reach. Perform hand hygiene. And then go back to out of the room. And I'm going to come over here and initial. My site was the right abdomen, so R6, and then I can put my medication